is also highly suspicious. So, coming to introduction point, the violent crimes of or offences occurring in the cities, in small towns, all over the world, every day, 365 days throughout the year. So no place is exemption from this. The investigating authority gets perplexed to find ways to solve a case which is often so complex in nature. Motive to crime, violence may vary from case to case. So it is routinely we are observing during our experiences, no cases compared to other case. Each every cases, post-mortem case especially, it is a unique. A personal ambition, frustration, group activities, financial drawbacks and aspirations are predisposing factors for occurring of crimes. The death investigation prove evidence to convict the guilt and protect the innocent, whether they are accused of murder, child maltreatment, neglect or other crimes. The death investigation aid in civil litigations such as malpractice, personal injury or life insurance claims. Death investigation are critical for many aspects of public health practice and research, include surveillance, epidemiology and prevention programs, most often an injury prevention and control, and also prevention of suicides, violence, substance abuse. So any criminal case to be proved beyond the reasonable doubt to the satisfaction of the courts of law, a thorough and methodological criminal investigations is the foremost requirement. Involvement of an element of an assault or injury to a victim and one or more scene of occurrences or crime. So may not be seen in all in one place. A fair investigation must include identification, collection of various physical evidence, including biological ones, interconnecting them before presenting in the court of law. The gathering of evidence must begin from the scene of crime itself, and that too at the earliest. That is gathering of evidence. The investigation into offence against human body will warrant for wide knowledge of structure, function and anomalies of human body, and sometimes point to corroborate and relate to chain of events. The police investigation and photographs are not a substitute medical experts at the crime scene. It is very true. In India, inquest conducted by most of the times police and sometimes magistrate in few cases. So it is very difficult autopsy doctor interpretation manner of injuries over dead body sometimes unless the doctor visited scene of crime. So the existing criteria for the selection and the job training do not lay emphasis on requisite medical jurisprudence. The investigators are one of the first persons to visit scene of crime and plan and to decide upon the further course of action. Due to growing need and demand for objective, methodological and scientific method of investigations, investigating officers started arranging for scene of crime visit by forensic scientists and others. Presently, scene of crime investigation team in India do not have medical man, that is medical legal expert, forensic pathologist or general practitioner who is involved in autopsies or medical legal post-mortem examinations, as the member barring few exceptions. So non-medical person investigation usually lack of quality in terms of interpretation of complex medical legal complexities. The photographs of scene of crime serve as a good alternative but cannot substitute for a medical man observation having visited scene of crime. So eyes cannot see what mind does not know. Eyes cannot see what mind does not know. So what is crime scene? It is a place of occurrence of crime. So what do you look for crime scene? So look for any suspicious things related to crime and collect evidences such as fingerprints, footprints, tire tracks, blood and other body fluids, hairs, fibers, fine debris, depends upon the type of case. Are crime scene investigators or police officers? Of course, in India presently only police are doing. In some cases only magistrate doing investigators. The most of the biological evidences in the form of blood, seminal fluid, vaginal smears, hair, viscera tissues, pieces of skin, nails, etc. collected and preserved by the doctors, and almost always doctor is away from scene of crime. What is happening now? When the body has been shifted and transported to the mortuaries, usually many hours or even couple of days after the first visit by investigating officers of the scene of crime. It is true also. Example, in a case of poisoning, vomitus found at the scene of crime is known to have maximum concentration of poison, where the viscera collected much after consumption of poison. Usually after most of the gastric contents have been vomited out or evacuated by gastric levers, obviously contents for too less concentration. So it is not surprising therefore that the many of the cases viscera test negative for poison. So it is ironically but an unfortunate fact that police insist preserve viscera at autopsy rather than they are collecting valuable evidences at scene of crime. There is no sincere effort made to preserve vomitus from the scene incidents over clothing or gastric level samples, especially in poison cases. So deaths natural or unnatural, and it is very difficult to say unless meticulous examination of dead body as well as crime scene. So what is the criteria? Death, whether it is natural or unnatural. When do you say natural, when do you say unnatural? The natural death is due to disease, infirmity, old age or general debility without any ingredient of intention of action to terminate life, and also death not occurring accidentally. That is natural death. The unnatural death causes other than the disease or infirmity. The deceased person may die unnaturally in accidents, but it does not lead to cause of death in ordinary course of nature. So the deceased person met with accident and died due to injuries occurred due to accident, not because of the disease. So this person, if accident does not occur, may survive for some more time. Sudden death. What is sudden death? The person did not suffer from any injury, poisoning, violent asphyxia, dies all of a sudden or within 24 hours of starting of terminal illness. So all unnatural deaths, post-mortem examination should be performed, and every medical legal autopsy or post-mortem examination case is unique and do not compare with one case to another case. And scene of the crime also vary from case to case. All road traffic accidents need not be accidental, may be homicidal or suicidal, and it requires meticulous investigation and examination. So some witness statements also helps, and CC camera clippings also give valuable clue over this to solve the cases sometimes. And violent asphyxial deaths, especially hanging cases, are highly suspicious. Especially the hanging or asphyxial deaths occurs in open space, unbolted doors, rooms, or rooms have two or more doors are mostly partial hanging cases, public made allegations that the person was killed and hanged. Most of the times we get allegations. And firearm and gunshot injuries also similar. And railway injuries, especially decapitation, meticulous examination, both investigating officer and autopsy doctor also required. And one more important task, where there are no visible injuries over the body. So, in such cases, investigating officer totally depend on the doctor who is doing autopsy. The crime reconstruction is not an easy one, because we are dealing with human action and are trying to tell details what happened at particular time in the past. They may not be a full picture. We can sequence of events, but we cannot tell what happened between those events. The physical evidence may not tell whole story of what happened, but only isolated bits of the whole story. Whoever approaches the scene of crime, either in a person or through documents, must be able to understand that entire story may not be revealed. So there are some motives: crimes, suicides,